Hello students, so we continue our discussion further on one-sided diseases which are nothing but with too few symptoms of disease, and in this we are discussing local maladies. So let's see what is given in aphorism number 195. So first he gives the reference of aphorism number 194. So we again discuss what is 194. Have a look on 194 aphorism. So 194 aphorism, Dr. Hahnemann has mentioned that in acute local diseases of recent origin or local diseases of long duration which are chronic in nature, give internal remedy. So it is never advisable to apply or rub externally the same remedy. Not also in acute inflammations, that is erysipelas, which are not caused by external injury but caused by dynamic internal cause. They are cured by internal administration of similimum. So any local malady which is taking place on the external surface and it is of acute inflammations, then also we have to administer internal medicine. Okay, and this inflammation is not caused by any external injury. In local diseases, it is of no use to apply remedies locally for the topical application, even if it is same remedy that is used internally. So Dr. Hahnemann tells us clearly that never to do the local application for the local diseases where the cause is internal. So again I repeat, see the third point, not also in acute inflammation, for example erysipelas, which are not caused by external injury but by dynamic internal cause. Absolutely there should be administration of similimum internally. So, in local diseases, it is of no use to apply remedies locally for the topical application, even if it is the same remedy that is used internally. So, whatever remedy you are giving internally, don't apply same remedy externally. It is of no use. It will never cure. You may feel that I can hasten the cure. It is never the case. So strict instructions given by Dr. Hahnemann that in the acute conditions of local diseases, you have to give only similimum internally. Local diseases are cured readily by this internal medicine, and if not, then the acute disease was product of sora which was latent till now but active and may develop into chronic disease. So local diseases are cured readily by this internal medicine, and if not then the acute disease was product of sora. So if you don't see the results readily, then you must consider that this acute disease was product of underlying soric miasm which was till now latent and now has become active, and it has developed into chronic variety of local disease. Now what is to be done in such cases, that we will see in the aphorism number 195. So reference of 195th aphorism is in the 194th aphorism, that local diseases which are not readily cured by this internal medicine, it should be considered that these diseases are product of sora, and which was latent till now and now has developed into chronic disease. So how to treat such condition? Let us see. So, in local diseases which are cured by this internal medicine readily, and if not, then the local disease was product of sora. So, same point is considered here again, which was the underlying miasm, which was latent till now, but active and may develop into chronic disease. Such chronic maladies, which are of non-venereal nature of soric origin, treatment of such diseases to effect a cure is by administration of anti-soric remedy. So, in such conditions, Dr. Hahnemann gives strict instructions that you have to cure such condition by administration of anti-soric remedy. So, we go further. Aphorism number 196. See the further instructions given in the treatment of local maladies. It might seem that cure would be hastened by application of remedy locally as well as internally. So physician might think that the cure will be hastened. Cure will be more speedily when I apply the remedy locally as well as internally. But it appears that cure might be hastened by the internal medicine plus external local application. It is just assumption. It is not a statement. So, in aphorism number 196, the only point is it may appear that cure might be hastened by internal medicine as well as given external local application. So it is just assumption, it is not a statement made. And aphorism number 197 will give you that the clear cut instruction, but this should not be done. So I want you to remember this point itself here, that it may appear that cure might be hastened by internal plus external local application, and he is giving the clearance in further in 197th aphorism, but this should not be done. So never to give internal as well as external, internal medicine plus external local application. Never to give internal medicine plus external local application. Let's see further. Aphorism number 197. So in continuation of aphorism number 196, it appears that cure might be hastened by the internal medicine plus external local application. And to hasten the cure, you might think to do this, but this should not be done. It is not advisable. In diseases where there is local symptom on external surface of body, the application of remedy to the surface may annihilate the local symptoms. The application of remedy to the surface may annihilate the local symptoms before the internal disease. This may seem to be a cure, but it is not a cure. So in diseases where local symptoms is present on external surface of the body, and application of the remedy to the surface may annihilate, it may remove the local symptoms before the internal disease. And this may seem to be a cure, but it is not cure. So remember, so Dr. Hahnemann is giving the clear cut instructions what you might feel. So you might feel that the application to be of remedy done externally may remove the local symptom before the internal disease, and this is not cure. You may feel this is a cure, but it is not a cure. So aphorism number 198. The use of local application of remedy which is powerful to cure when given internally never to be done. So never to use the local application. So I have put it in red to have the clear cut indications, clear cut instructions given by Dr. Hahnemann that use of local application of remedy which you seem powerful to cure when given internally never to be done. Okay, so internal and external same application never to be done. If the local affection is removed, then what happens? Then most distinguishing symptom is removed for selection of remedy. So you are removing the most important indicator for the selection of similimum. The symptoms which remain now are less peculiar, less characteristics. Picture of disease is now cannot be formed as many characteristic symptoms are removed. Now you have removed a very important pointer for the selection of remedy. You have removed the main important symptom for the selection of remedy. And what happens now? Only few vague symptoms remain, and which is going to give you not a clear cut picture of disease. Okay, so use of local application of remedy should not be done, and it is powerful to cure when given internally, but the local application never to be done. Okay, so be clear in this that the never to be done is for local application, and the same remedy will act powerfully when given for cure. Okay, so we go to the next. So we have understood from 198 aphorism that internal remedy is given, but its same remedy should never be applied externally. I am very clear again. In the treatment of local disease, if internal remedy is given, it is powerful to cure, but same remedy should not be given externally strictly because it will remove the symptom, very important symptom, which was important for the selection of remedy, and now whatever remains the symptoms, they are not able to form the complete totality. So 199 again same discussion is further done. Double problems arise when remedy perfect to the disease is not yet found. So again addition, the problem is added that when remedy perfect to the disease is not yet found and local symptoms are removed by corrosive applications. So first of all, local maladies are diseases with too few symptoms. On top of it, what happens that the perfect remedy cannot be found owing to the few symptoms. And now the whatever the most important symptom locally present on the external surface of the body, if removed by corrosive applications, then case becomes much more difficult. Due to characteristic symptoms present, they are removed. Hence, the case becomes difficult. Uncharacteristic symptoms may remain, they remain and they are present. So, selection of simillimum is difficult. Local symptom which was removed may have contributed to the selection of the remedy, and its internal employment would have annihilated the disease totally. So 198 and 199 is giving us the instruction that never to apply the local application, never to apply the same remedy externally which is given internally. And if this condition happens, then you are removing a very important characteristic symptoms from the case, and that too if the remedy choice is not perfect owing to the lack of symptoms, the difficulties are added one after the other. So, if you remove the symptom by local application, selection of simillimum becomes difficult as you are removing the very important pointer for the selection of simillimum. So, we go further. Aphorism number 200. What it gives, that the continuation is there of the 199th aphorism. If this local symptom was not removed, then the perfect suitable homeopathy remedy was found for whole disease. So if the local symptom was not removed, it would have been the perfect suitable homeopathic remedy easily found for whole disease. External malady as well as internal morbid symptoms would have been removed by this suitable homeopathic remedy. If after employment of internal remedy, local symptoms persist, it means cure was incomplete. Now we are applying only internal remedy is given, is administered, and if the local symptoms still persist, it means cure is incomplete. Then what is to be done? See, if local symptom disappears after the internal medication, then it means the desired result of cure is accomplished. This is possible only when local external symptom was not removed by ointments. So never to remove the local external symptom, because it is the most important vital pointer for the selection of remedy. And as you know, local maladies is a type of one-sided disease. So one-sided disease, as also it is having very less symptoms, and out of that, if you are removing the most important vital symptom present locally, then it was actually a very good pointer for the selection of the remedy, and you are removing that. So if the local symptom disappears after the internal remedy, then cure is accomplished. Okay, so never to remove the local symptom by ointment. We go further on 201st aphorism. So one-sided diseases like too few symptoms, the local maladies, how they should be treated further. So vital force keeps the chronic disease. Now very important, how these local diseases are getting formed, how do they appear, and what are the interpretations. So vital force keeps the chronic disease by adopting the plan of developing malady on external parts. So it is in nature that whenever there is a disease which is getting started producing the disease, the nature itself keeps the disease on the external parts like skin, means keeping the disease in silence and protecting the internal organs. So it is in nature that the development of disease first takes place on the external parts of the body, protecting the internal organs. So it transfers this internal disease to local disease, thus protecting the vital organs. The local malady silences the internal affection but without curing the internal disease. So if the local malady like say eczema appears on the skin, it means that it has silenced the internal affection but without curing the internal disease. So, local malady has silenced the internal affection, but that does not mean that it has cured the internal disease. That does not mean that it has cured the internal disease. Local affection is a part of general disease, and as the disease gets worse, the external manifestations also get worse. So always remember that local affection seen on the external surface of the body is not any separate disease, but it is a one disease phenomena, internal as well as external. You must not separate the local disease from the internal symptoms of the disease. Internal symptoms means the symptoms of mind and body. So local disease is a part of general phenomena of disease. Local disease is a part of general phenomena of disease. It is not a separate disease. Vital force cannot remove internal disease, but internal disease increases and thus local affection also increases to keep the internal disease under control. So, vital force cannot remove the internal disease, and neither the local malady like eczema which has taken place on the surface cannot remove the internal disease. Although eczema has occurred because of internal disease, it is not going to cure that internal disease. Vital force itself cannot remove the internal disease. And if internal disease increases, local affection also increases to keep the internal disease under control. So as the internal disturbance increases, local symptoms also increases, and it is the in nature that why the local affection increases to control the internal disease under control, to keep the internal disease under control. Old ulcers increase as the internal sora increases. Chancre increase as internal syphilis is uncured. Warts increase while psychosis is uncured. So this scabies or skin eruption increases as the internal sora increases. So scabies, that is the eruptions, on the skin represent the psoriatic miasm. It represents the local external presence of psoriatic miasm. All the local maladies are the outlet for internal disease. They are able to silence the internal disease. Local affection silences the internal disease, and it is in nature to protect the vital organs by keeping the disease on external surface. So we have already seen never to remove these external symptoms of disease by ointment. We have seen in these few last aphorisms. So never to remove the disease by local application, never to remove the disease by the same remedy which is given internally applied externally, never to be done. Now these local symptoms which are present on the surface, they represent the internal disease. And what is that internal disease? Nothing but your miasms. So psoriatic miasm will express as eruption, syphilis will express as chancre on genitals, and psychotic miasm will express as warts on genitals. So the expressions of the miasm also has been noted by Dr. Hahnemann. So the psoriatic expression is in the form of burning, itching skin. Syphilis is in the form of chancre, heart tumor, and psychosis is in the form of genital warts. So SORA is non-venereal chronic disease, miasmatic in origin. Syphilis and psychosis are venereal diseases. So they are expressing as chancre on genitals and condylomatous warts on genitals respectively. Okay, so chancre corresponds to syphilis and warts corresponds to psychosis. Now this aphorism, according to it, the eruptions in psoriatic miasm have kept the psoriatic miasm under control, but this is not going to cure the psoriatic miasm. Vital force alone also cannot cure the psoriatic miasm. Only cure is possible by administration of anti-miasmatic, that is anti-psoriatic remedy. For removing of the syphilis, the anti-syphilitic remedy has to be given, and to remove the psychosis, the antipsychotic remedy has to be given. So today's discussion we stop here and continue further next time. Thank you.